leave. All right. Senators, we're going to then proceed on our bills we haven't heard. If we can get them out in a very expeditious manner, then we will do so this morning. Otherwise, they may get referred to a subcommittee. So first on the docket would be Senate Bill 827, Senator Favola. And as a Senate patron comes up, we will take all the matters that you have before us when you come to present, so that you don't have to pop up and down.
Okay, thank you, Mr. Chairman. Senate Bill 827 deals with hospital emergency departments. And what this bill does is it requires hospital systems to submit a security plan to the Commissioner of Health. And within that plan, there is an expectation that a trained security person be in their emergency departments 24/7. Unless information is provided that would indicate a 24/7 time frame is not necessary. We would expect a report to the Commissioner of Health that would deal with, the volume of cases that may come through the emergency department, the complexity of cases, et cetera, et cetera. And then we also have a waiver option in here that the Commissioner of Health would be able to apply. We worked with the Virginia Health and Hospital Association. We worked with the emergency department physicians. There's an association that represents the emergency department of physicians. And I expect that there's probably maybe one or two speakers at most in support of the bill. I am unaware of any opposition.
All right, thanks, Senator. Members have heard the bill presented. Any questions of the Senate patron? Anyone in the audience to be heard in support of Senate Bill 827? Brief is good.
Yes, sir. Good morning, Mr. Chairman, members of the committee.
Delegate Scott, did you have a question of the patron?
I do have a question for the patron or anybody else who may be able to answer the question.
All right, go ahead and pose your question before we take testimony, please.
The question that I have is how many hospitals currently do not have security for their emergency departments?
I'm unaware of that number. Most of the large hospital systems do have security. There are large hospital systems that have emergency departments that are off campus. And that may be an area where we don't see as much security, but it is needed.
Thank you. Continuing with public testimony.
Just to interrupt briefly, Brent Rawlings, Virginia Hospital and Healthcare Association. I think that's a good answer to the question. We did not do a survey to confirm one way or the other whether or not this standard was met. We assume today that the standard is not being met and that there will be a process in place to accommodate that as we go forward.
All right, thank you, Brent.
Mr. Chairman, members of the committee, Amy Perrin-Seibert on behalf of the Virginia College of Emergency Physicians. We support this bill. We appreciate all the work that everybody has gone into this bill, including the work with the patron, the Hospital Association, the Medical Society, and the Nurses Association. We really appreciate it. The violence has been increasing greatly in the emergency departments, and we really need someone to be there to be able to answer those situations when they happen. So thank you.
Thank you.
Clark Barron with the Medical Society of Virginia, and we support the bill.
Good morning, Ashley Apple from Virginia Nurses Association. I worked as an ER nurse for over a decade. I've been hit, kicked, spit on. I've defended my coworkers and myself from attack. I've locked down the hospital waiting room and due to credible threats of violence. And last time I checked, this is not within the job description of a nurse. In the wake of COVID-19 and in the midst of a healthcare staffing crisis, tensions are perhaps the highest they've ever been in emergency departments across the country, Virginia included. So we ask that you please support this bill in order to protect not only nurses, but patients, visitors, and all staff members in the hospital setting. Thank you.
Thank you.
Good morning, Elizabeth Hobbs, Virginia Sheriff's Association, and we also support the bill.
Thank you, Elizabeth. Others in support? Anyone to be heard in opposition to Senate Bill 827? Delegate Cherry.
Thank you, Mr. Chairman. I just want to make a comment that I'm very supportive of this under the understanding that also the next step to this is that they take custody of ECOs and TDOs, because that's another thing that we need to address with the security of our hospital is getting our police officers out. So I'm supportive of this under the understanding that's the next step.
Be careful what
That
you
might
ask
be the
for.
wish of many stakeholders.
Okay. Moved, properly seconded to report Senate Bill 827. If there's no further discussion on the motion, please record your vote.
Delegate Willett.
Yay.
Your bill is supported, 19 to nothing. You have another, I believe, Senate Bill 923, and I will tell the senator we